Good afternoon. I'm joined today with Dr. Cyndi McLeod, Chief Executive Officer, GUS North America, and Dr. Diana Mockute, Chief Partnership Officer, GUS North America, to discuss the recent partnership between Canadian University Dubai and GUS North America for medical pathways of students of public health at CUD. I'd like to start welcoming both of you to Dubai and to the Canadian University, Dubai. To start, Dr. McLeod, at CUD, we pride ourselves on delivering academically rigorous programs that prepare students for real-world challenges. How does this partnership align with GUS Canada's academic standards, and what specific opportunities do you see for students to bridge their foundational knowledge with advanced medical training?
Okay, first of all, thank you very much on behalf of Diana and myself to be back here with the Canadian University of Dubai and on your fantastic campus. It's amazing, and we're so impressed with the students that we had an opportunity to meet this morning. So this partnership really aligns with GUS's commitment to maintaining the highest academic standards and preparing students to excel in real-world healthcare environments. And so we've conducted a thorough mapping of CUD's BSc in public health curriculum, and we found an extremely strong alignment with the pre-medical education standards of our three medical schools in the Caribbean islands. So the pathway that we've established together ensures that your students at CUD, graduates, not only meet but exceed the foundational requirements that they need to succeed in advanced medical training. We have small class sizes, we have clinical rotations, and experiential learning opportunities, so students can once again seamlessly bridge their public health background to the intensive hands-on environment of our medical schools. So we believe that this approach is going to provide us a natural progression from theory to practice, equipping students from CUD with the skills and knowledge to thrive as future physicians.
Moving forward from your last statement, there's a general understanding that research and hands-on training are critical components of medical education. In your opinion, how does GUS Canada integrate research and practical experiences into its programs, and how can our students benefit from these opportunities as they transition into the medical schools?
That's a great question. So at our GUS medical and veterinary schools, research and hands-on training is at the core of everything that we do, at the core of both medical and vet programs. Our medical schools are distinguished by their integration of classroom instruction with real-world clinical exposure. Through our early clinical rotations in accredited teaching hospitals across the U.S. and Canada, our students gain hands-on experience under the supervision of seasoned healthcare professionals. So research opportunities, as I said, they're embedded within our curriculum, with students engaging in projects focused on improving patient outcomes, public health strategies, and clinical innovations. For CUD students, this transition will be seamless. I keep using that word because I believe this is very core to the partnership between CUD and GUS North American institutions. So we're looking for that seamless transition. So once again, students from CUD can immediately apply their foundational knowledge to research-driven, patient-centered environments. And the combination of their experiential learning and research ensures that our students will develop critical thinking, adaptability, and a practical understanding of patient care. Do you want to add, Diana? Go ahead.
Indeed, Dr. Cyndi and Dr. Aseel, if I may jump in, where we see the synergy of this partnership, identifying those students that choose that route, then actually getting them into familiarization of our let's say, info session setup, invitation to a guest speaker, seminars that our first year students attend. Currently, everything can be facilitated virtually and through beautiful facilities that you have and the modern technology that supports that initiative of getting those students while they are here, getting ready for their preparation of arrival to our schools, really immerse into what the classroom looks like at Medical University of Americas or Sabre University or St. Matthew's University on Grand Cayman. Not only invitation to guest speakers, but also participation in some of the joint programs that currently we're planning in setting up together as a partners and giving that opportunity to students.
Opportunities are limitless.
Indeed.
So one of the goals at CUD is to ensure that the graduates are globally competent, and it seems nowadays the word globally competent is very hot, and they need to be ready to contribute to the international healthcare community. In your opinion, both ladies, how does GUS Canada's curriculum prepare students to meet global standards, and what role do you see this partnership playing in fostering cross-cultural competence amongst our students?
So I'll start with this, and then Diana, if you'd like to jump in. So first of all, our curriculum is developed with global competencies in mind. We've got a global faculty. We have what I would say is a global advisory committee for our curriculum, and we continue to adapt, improve, and strive to ensure that all of our graduates are prepared for a diverse healthcare environment with global competencies. For example, we're working right now to ensure that we have a lot of AI integration into our curriculum. Again, we're using an advisory committee of doctors and alumni, not only from North America, but from other parts of the world. We also adhere to a rigorous international accreditation standard, ensuring that our students are prepared to practice medicine in various countries, including the US, Canada, and beyond. We also have clinical rotations in multiple regions that expose students to different healthcare systems, whether that's at a provincial or state level. Also medical practices and patient demographics, fostering that cross-cultural understanding and adaptability. Any doctor now that's working in Canada or the United States or having their internships or residencies are going to be exposed to many cross-cultural opportunities developing those competencies.
Yeah, exactly, Cyndi. I think where medicine right now really becoming very global and universal with AI innovation and technology. We see, let's say, smart devices, right? Where now the new incorporation in the curriculum of reading those new technologies, educating our doctors, that's applicable around the world, no matter where
no
the
boundaries.
Students. Indeed. AI is actually really making no boundaries in medicine, and it's pretty much universal at the moment, including sustainability in medicine. And that's another one very universal topic that we're looking in implementing into our curriculum.
Okay. As any academic, the main concern always is the students, their future, their graduation succession plan, where will they be? But at some points, us academics can be selfish and think a bit about our career development also. So I'd like to know, beyond creating pathways to medical schools, I'm very interested and actually curious about the potential for long-term academic collaboration. Are there opportunities for joint research initiatives, faculty exchanges, or any collaborative projects that could further enrich the academic experience for both CUD and GUS Canada faculty and students?
So I think this is an extremely exciting element of our partnership. We believe that we have many, many opportunities for faculty exchange, for joint research, some creation of brand new joint programs together. There's areas such as public health, preventative medicine, research in global health challenges. And now with our medical universities, we're starting to create new partnerships with healthcare corporations, with healthcare technology groups, with provinces, with states, where there will be a lot of opportunity for particularly joint research. We're in discussion now with a very large group in Canada looking at the area of dementia, for example. And so I believe this will be very, very important as we go forward. How can we collaborate beyond helping our students be successful, but academic collaboration and research?
We at CUD always pride ourselves on having strong cohorts when it comes to Bachelor of Science in Public Health. And one of our strongest cohort is currently about to graduate. Our fourth year students are about to graduate. What advice, and that includes you, Dr. Diana, what advice would you give these students as they are currently considering their next steps?
Yes, if I may start, I think it's really incredible. We're truly impressed with CUD excellence in academic preparation. It was inspiring to see all the potential future physicians in the room and actually the excitement in their eyes as we speak about medical education. Really, today the world needs more doctors. Just to quote a few numbers, in United States by 2034, nearly 130,000 family physicians are required, let alone specializations that some of the physicians need to bring to the high in demand market right now. In Canada, we see enormous challenges with the absence of family physicians. And by 2031, just 6 years away, we're looking at almost 50,000 in general practitioners and also close to over 30,000 specialists required in Canada alone. So really the world needs more doctors. And having those CUD graduates actually get through medical education with a very strong and excellent foundation, not they're gonna be just doctors, they will make successful doctors. They're the ones that drive research, innovation, because we know as medicine as today also requires that innovation and transformation. So we see the future physicians not just as physicians at CUD, but those innovators in medicine that actually we believe this partnership strongly can create that we all can be proud of.
And they should be able to be both interdisciplinary and multidisciplinary.
Exactly.
100%. And, through our medical schools, they can explore opportunities in internal medicine, pediatrics, for example, public health-focused specializations. But we also want to really encourage the graduates to really think broadly about the role that they can play in healthcare. One of the things that we're seeing with many of our alumni now is their emphasis on developing medical technologies. We're seeing this everywhere around simulations, different kinds of applications that are being used. And it's quite interesting to watch the transition of healthcare and how technology is playing that very important integrated role. We're also, again, as we said earlier to students, there's a huge gap in that family medicine specialization. And so we really want to encourage young graduates to look at those opportunities, especially across North America, in the smaller communities, there's a real shortage. So, some advice also is to try to encourage the future graduates for continuous learning. They need to be adaptable. And we need leaders in healthcare. We need strategic leaders that are going to think about policy and help negotiate with government and on where the healthcare challenges are and the kind of investment that we need in our countries. So innovation, compassion, to be compassionate, empathetic. As they graduate in this field, they take on an oath of how they're actually going to care and help people. If they go in the veterinary area, it's almost the same oath of how they're going to help, pets, whether they're small or large animals that are very much loved by families or an important part of economic driver, whether it's food or, with animals. So we believe this partnership with the kind of students that we saw today, that together we're really in a place where we can empower young people to be leaders in this field.
So current students and prospective students start your degree in a Bachelor of Science in Public Health and finish with a medical degree in North America through the GUS CUD Medical Pathway Agreement. Dr. Cyndi, Dr. Diana, thank you for your time. We appreciate the time, the effort that you have put in making this partnership a success and a long-lasting partnership.
Thank you. We look forward to inviting you to future convocations where you'll see your students crossing the stage as a medical or veterinary doctor. Thank you so much for having us today.
Thank you, Dr. Aseel. Very nice to meet you.